Hello everybody, welcome to the first Facebook Live broadcast for the MSc Public Health. My name's Paul Pilkington, I'm a Senior Lecturer in Public Health and I'm also one of the admissions tutors here at UWE. On my right, it's difficult looking at the screen, is...
Hi everyone, my name's Emma Bird and I'm also a Senior Lecturer in Public Health and I share the admissions role with Paul for the programme.
And on my left?
Hello everyone, I'm Stuart McLean and I'm the Programme Leader for the Masters.
So we thought we did this last year with a few sessions, Emma and myself, and we've been recommissioned because it was highly successful.
Yeah,
so we've got a few more sessions for this year over the next month or two, and just giving you an insight into the Masters, talking to some of the people who helped deliver the course. And also hopefully some students as well, and ex-students, to talk to you about their experiences of doing the Masters at UWE. And it's an opportunity for you to ask questions. Although I'm not sure there's anybody watching. I don't know whether anybody is around, but if anybody is watching and wants to say hello by typing hello, please do, so that we know we're not talking to ourselves. Should we just explain a little bit about the university first? Yeah. And where it is. So for those of you who don't know exactly where it is, it's based just outside the city of Bristol, just a couple of miles really outside the city centre, on quite a greenfield site. So it's quite a pleasant campus, quite a large campus, but with easy transport links into the city. And there's a number of university buildings that are also based right in the city centre too. So UWE actually is quite a large university, isn't it, really now? I can't remember the statistics, but it is a large university occupying different sites within the city. But this main campus at French A is where the public health team are based and where the Masters is taught. So this is where you'll be based. We're currently in one of the new buildings on campus, which is the Faculty of Business and Law, which is a lovely new building, and obviously, if you come to UWE, you'll get to see it. I do feel like we're talking to ourselves here, but I'm assuming there are people watching. If not, they can watch it. They can watch it back. Do you want to say a little bit now about the actual Masters?
Yeah. So the Masters course, for those of you who have already applied or thinking of applying, it runs. As a full-time course, it runs over 2 to 3 days, effectively, during over 2 semesters at the university. So, and then for the part-time students, you study a day a week. So the university dates the induction sessions, which is where you learn about the department, the university and our systems, and you meet the staff. That starts on the 20th of September, which is a Thursday. And the induction, whether you're a part-time student or a full-time student, it'll actually be over 2 days. So the idea is that we'll attend on Thursday the 20th and Friday the 21st. And then the teaching commences the following week, which is the Thursday the 27th. So all students will be attending on the 27th for the first day of teaching. Once you get started in university, if you're a full-time student, you might then decide to start your dissertation, which is the big kind of project for your masters, and the workshops for that are on a Wednesday. So there are some weeks, I think it's 6 weeks in total, where you'll also attend the university on a Wednesday. At the university we have other development sessions, student support, study skills support, which may run on different days. So it's certainly, if you have the opportunity to be on campus or live on campus while you're at the university, that will also give you some advantages in terms of attending different sessions here. So that's really just in terms of when things are happening, and you know, the key dates over the course of the year.
Good.
Great. So I think somebody, the name of which I've completely forgotten, but they had actually emailed ahead of the session just to ask a few questions. And I think Stuart's just covered some of those with regard to the start date of the programme. But somebody also asked about the modules that we have on the programme, and also about the range of assessments that we have for students to complete. So we've got 9 modules in total, and if you are interested in finding a bit more out about those, please do visit the UWE website. You can have a little look at the range of modules that we have. We also have a brochure that one of our colleagues, Nick, put together, which sort of summarises the course in a little bit more detail than what's available on the website. So if you are interested in getting hold of one of those, or you haven't had one from Paul or me yet, if you have applied, feel free to get in touch with one of us, either on via the Facebook group or email us. As many of you I know have already been in touch with your applications, which is great. Just thinking about some of the assessments, I think one of the things that we've really worked on as a programme team over the last few years has been about trying to offer a real range of assessments for modules. So it's not necessarily what you might be expecting in terms of very traditional, very much exam-based assessments. We do have some exams, but we also have coursework, which might be an essay, or we also have another module assessment, which I could talk about in a bit more detail as it relates to my module, health promotion, which is, we kind of think is a reasonably novel idea for an assessment, which is where students are asked to develop a website about a particular health promotion issue that they have interest in. And this is something that we've been developing over the last couple of years. And it's all about developing not only your knowledge and understanding around health promotion theory, policy, practice, but also about developing your IT skills. So part of the decision around that is to really help you to have skills that are actually going to be applied when you go out there and you're working in different public health roles.
Yeah. Can I just add something to that, really, which is that you know, we've tried to ensure that balance in the approach to assessments, because we know that as students you get good at different things. So some of you may prefer exam time-based assessment, some of you may prefer to write a piece of coursework, but at least then having different options means that, you know, there's something for everyone. And we also some of our assessments are based on presentations as well, so both individual presentation and group ones. So again, you know, we've tried to ensure that there is some diversity in that approach.
Yeah, just a bit about I guess the course overall as well, and the kind of the ethos of the course. Like, we're very much a multidisciplinary public health team. We're from a variety of backgrounds, including a range of social science areas such as sociology, psychology, geography, history, I missed any others? Anthropology. And we've also got people from medical backgrounds who contribute to the programme. So we've got a wide range of disciplines involved, and the course is very much multidisciplinary by its nature, and has a very strong emphasis on issues like social justice, health inequalities. We've got a good international flavour, both in terms of the students on the course, but also the topic areas that we look at, and we make sure that we always connect to the global, as well as looking at examples from countries as well, including the UK. And we've certainly increased that kind of global approach, haven't we, over the last few years, as we've got a more diverse student group. We've got a really good mix between students from the UK and students who come from a range of other countries, and I think the group seems to really value out of that mix, don't they? And that's one of the really great things about actually being on site and doing a master's rather than doing it at a distance, that you actually get to meet lots of different people and get to hear about their experiences in public health and discuss issues and hopefully make good friends and connections then for work after the master's.
Yeah, yeah, definitely. I think that's that's something we've certainly worked hard to try and do, and we're aware as students, particularly if you're an international student, you'll probably be interested in coming to the UK because you want to learn a bit about the UK system and public health here. So you'll certainly get that as well. But it's also important that we, over the years, we've tried to develop other kind of international examples and contexts to give you a kind of flavour, the breadth of public health activity in the UK and internationally.
Stuart, did you want to say something about the AFIA accreditation? Because I've forgotten what the acronym stands for.
Yes, so we are, I don't know if that's something that we advertise on Facebook, but
I'm not sure we have actually.
Yeah, so the Masters has an external accreditation, which is from the Agency for Public Health Health Education Accreditation. So that's essentially what the AFIA acronym stands for, and it's there are very few universities across Europe that have the AFIA accreditation. It's a very rigorous process that AFIA insist on in order to give you that sort of stamp of credibility for public health education, and it means that as a provider of public health education, we're not only aware of just the things that go on, in the UK, but that we have an understanding of how things work internationally and across Europe. So it's something that we're really proud of. It's a really important recognition, like I say, of our credibility and the international standing of the course.
Yes, and on that note, in terms of the wider university, we've just been awarded a gold status in the Teaching Excellence Framework
I have a nice badge.
in the UK. Emma's got a special badge because of her special efforts with excellence.
We've all started wearing gold.
That's not quite true.
So, if you are from the UK, you might not have heard of this actually, even if you're from the UK, but it's a relatively new process of assessing the quality of teaching in universities across the country, and gold, as you might guess, is the best. So you can get silver and you can get bronze, but UWE have just been awarded gold, which I think we have for the next 3 years at least, and hopefully that's a good reflection on the quality of the teaching here. So the institution does a variety of things, including teaching, but it also does a lot of research as well. But certainly it's always seen a strength in terms of its teaching, and this is a great recognition of that. So hopefully that then gives you confidence that you're looking for a good teaching experience, and this is a university that has been recognised nationally for that.
So one of the other things, just based on questions from last year, that we had when we did some of these sessions, and again, if anybody is out there watching, please do feel free to interrupt us and type in any questions.
I hope it's recording our sound and voice, otherwise it's going to be extremely tricky to understand.
It
does say it's live, so
it does say it's live, and it says we've been on for 14 minutes, so we'll just assume that it's working, even though we've not heard from anybody. But we'll assume you're all very shy, or you're just going to watch it later on.
So
it's like Netflix, you can watch it whenever you want.
On demand.
Oh, yeah, on demand.
Yes. Wow. So one of the questions that we often get, particularly when we meet prospective students who maybe come into UWE to kind of learn more about the programme, or last year when we did these sessions, we asked for questions. And one thing that came up quite a lot was around employability options following completion of the Masters. And of course, that's a really important thing for you to be thinking about, is kind of where you want to go once you've got your Masters, what it's going to do for you. And so just to give you a little bit of an overview of some of the recent things that people have gone on to do, we have a real range. As Paul mentioned, we have some UK students who are maybe already working within public health, who are using their masters to progress within their particular role, and maybe get some sort of promotion. But then we also have a lot of people who are coming who are maybe completely new to public health, and are looking to move into it, maybe have a career change. So that's both in the UK and for international students. So within the UK, some of the stories that we've heard have been around people going into jobs around maybe within the local authorities, and also for organisations such as Public Health England. We've got students who've gone onto those routes. And then internationally, we've had some really good news stories actually in the last week, which I mentioned on the public health group yesterday, but just in case you haven't had a chance to see that, we've had one student who is graduating this summer, who has got a job as a WHO, World Health Organization consultant, which is absolutely fantastic news. And then also another student that's graduating this summer, Anthony. He is going on to work as a research associate on a project looking at the health of residents in slums in Nairobi, which sounds absolutely amazing, really fascinating project.
It was a big research council funded student as well, wasn't it?
Yeah. So he's done fantastically well to get that. And I think obviously getting through the masters and doing well on that has really boosted those guys' CVs. So we do feel like we have a good track record in terms of what you can go on to once you've got your masters here at UWE.
Yeah, absolutely. Yeah, there's something, it's the masters should have and does have a career enhancing effect, for all our students. And whether you're already working in a kind of public health type role, whether you think you're starting out, that masters is increasingly seen as a kind of entry level into a lot of public health roles in different organisations, or if you want to go into research, as some of our students do, then is an essential qualification.
Yeah, and on that note, it's a very good segue there. I mentioned about research before in terms of the fact that we do research as well as teaching, and research is really important to us in the public health team. And first of all, most of us are active researchers as well as teachers, and across a range of areas. And what we do is we make sure that informs our teaching, so we can bring in real life examples. Obviously, not just talking about our own research, which might get slightly repetitive, but also other research within the team, and of course wider research as well. But there have been quite a few instances actually where students have done dissertations which have been connected to interests of people within the team, but also we've had graduates who have actually stayed on with us and done pieces of work, either short-term projects or longer-term work. So we've got a couple of people who have actually known a couple of people who are graduates of the masters who are I was going to say still around. It makes it sound like they're hanging around. Well, they're not. They're active members of the team, and it's just a great sort of example of how you can go from that masters to a research career. Stuart said.
Yeah, absolutely. Yeah.
Hi Viola, by the way. Just to see you're watching. No problem about coming in late, and you can always catch up on the Facebook page. But if you've got any questions, do let us know. Otherwise, we'll just continue whittling on, which we can do forever because we're lecturers. So what should we talk about next? I've just said that. What should we talk about next?
I was thinking of mentioning the placement.
Yes, that's a good idea. Yeah.
So within the programme, something that some students often ask about is, how can I get experience within public health? What do I need to do beyond just coming in and doing a master's? Something that's actually been brought into the the sort of added extras, I guess, of the programme is that there are opportunities around placements. So it's being organised and run by one of our other lecturing colleagues, Izzy Bray. And there are, I think, around 5 each year, 5 opportunities, 5 placements available, based in different public health workplaces in the southwest. So there have been opportunities at the local Public Health England office. I know there have been some based in some of the local authority offices as well in the public health teams. And these are competitive placements, so they are put out almost to advert to public health students. But what we tend to find is that not everybody wants to do a placement because, as we mentioned earlier, some people are already working within public health. So what we tend to find is that for those people that apply, generally speaking, they get an opportunity to go and work on one of those placements. And they are arranged to be attended on days that are not teaching days. So you maybe would go for 1 day a week for 6 weeks, something like that. So you get an opportunity to maybe shadow somebody who's already working in public health, or perhaps work on a small piece of research for a team who maybe haven't got capacity to do it themselves. So there's kind of an option for you to learn new skills there. But yes, it seems to be something that the students feedback on very positively. And again, it's just something you can add to your CV, particularly if you're coming to public health from a kind of different background and it's all quite new to you.
Yeah, that's right. So I think these placement opportunities are negotiated each year, and I think we have a charity as well, which we're hoping to have some involvement with as well. So those opportunities might increase next year. It's difficult to say. The other thing to mention is that the work experience is kind of outside of the teaching timetable, so it doesn't really clash with the formal part of masters.
So what else can we cover? We've done research, we've done the teach, haven't we?
Yeah. Viola, do you have any questions for us? Feel free to type away. Yeah, I feel like we've covered quite a lot in the time.
I think so. I suppose the only other thing just to clarify is with all the modules, most of our modules are what we call 15 credit modules, and the credit system is a system that's specific to UK higher education, and it's a modular system. Each of the modules run for, I think it's 8 weeks. And then on top of that, so those are quite short running modules. You do assessment for each of those, and then the dissertation is 45 credits. So effectively, the dissertation is really 3 modules. So it's quite an important part of the masters. So coming into the university and starting the masters, if you're a full-time student, I think it's usually a good idea to think in advance of what are the kinds of things that you might want to do a piece of research on. Given that the dissertation does have that much weighting and that much importance for the masters overall, it's a good idea to sort of work through some of those issues quite early on. So if you have any ideas about research projects or things you like to work on, then you should also let us know about those as well.
Yeah, and I suppose we're talking about the dissertation. We aim to be as supportive as we can be, certainly in those early stages, which are really important when you're thinking about your dissertation topic. And we've got a system where you submit a protocol for your dissertation, which is then looked at by 2 academics in the team who give feedback, and then that allows you then to make changes, which then you can work with your supervisor on. So we find that's a very helpful process for helping people to focus on kind of like the best possible dissertation topic they can. And it's kind of just an area of support that we've put together. How many students?
There's one other thing I should maybe just mention is when you come into the university and you start the masters, there's all sorts of different systems of support to help you with your study. So in terms of the master itself, when you join, you're given a personal tutor, and that tutor is there to sort of help you navigate the university systems. The masters itself as well, your learning styles, your ways of studying, other kinds of issues. So that will help in terms of your integration and getting a really good start. And I think that, getting to those induction days, making a really positive start at the beginning can really make a big difference. And as well as the actual support from us as a program team, you get support from the university with the sort of study skills type things. And from what I've heard, they're excellent, really excellent.
So Viola, you asked how many students are there in a class. Well, we share quite a few of our modules. We share with students on kind of us. It's not really a sister MSc, is it? But it's an MSc which is in our same kind of subject group, which is the MSc in Environmental Health. And so we share a few modules, which are public health modules, but shared with the environmental health students. And in those modules, we can have maybe 60 potentially students?
Yeah, about that.
So in the main lecture, there'll be maybe up to 60, but then often there'll be workshops, which will be less. People, maybe about 20 in the workshop. On some modules that aren't used by the environmental health students, then you might get 40 to 50 in a class, and then maybe less then obviously in the workshops as well. So good size really, manageable in terms of allowing discussion, even in the lecture with maybe 40, 50, 60 people. The way the lecture rooms are here, it's quite easy to have discussions with a whole group as we do the lecture.
It is, that's right, yeah. So the lectures are the big classes, and that's not for everyone. So, we almost all of our modules encourage a lot of group work, which tend to be much smaller. So you get a lot of smaller interaction and focus as well, if that's your preference. So hopefully that helps answer that particular question.
Yeah, so maybe I suppose we've got other opportunities over the next few weeks with the sessions to answer the questions. It was less compared to Nigeria. Well, that's good. Yes, like some of the courses here can get very large, can't they? Some of the nursing courses, but usually with a master's course, we tend to have them smaller numbers, and then break out into kind of even smaller workshops, which we think is great.
Yeah.
Because it gives people opportunities to contribute really during the session, rather than being in a lecture theatre with hundreds of people. So what I was saying is we've got other opportunities to be doing sessions like this over the next couple of months, so plenty of time to answer other questions, and maybe as the word gets around, more people might join live as well as watching it on the Facebook group. So as I say, we will be having students on here as well, either current students or previous students, or maybe both, and also maybe bringing in other people in the team as well to talk about specific things to do with the course. So do look out for the announcements on the Facebook group. We'll give you warning obviously of when we're doing it, but it will usually be about this time on a Friday, because it's just is a nice time, isn't it? It's like nice and quiet in this part of the building as well, so we can do this. But I think we'll probably wrap up the session now.
Yeah.
Nothing else to say.
Send your requests in
to
Paul. Send them to
me or Emma. So, either. But yeah, it's a good point though. Yeah, in the meantime, if you've got any questions and you're willing to wait for the next session, you can send them in and we can answer them then. And if you're actually on the session, then you can also then ask follow-up questions, obviously. But hopefully you'll find this session useful. We're just about to wrap up on half an hour, so it's quite a good length session. And just look out for the next session. And thank you, Viola, for joining us live, and thanks everyone for who's going to watch it on catch up.
Yeah.
Great. So thank you.
Thanks.
Bye.
Thanks.
Bye.